Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Dr. Anthony Pivonka is a scoliosis treatment provider, utilizing scientifically based techniques to help people of all ages to overcome scoliosis. With June being Scoliosis Awareness Month, I was happy that Dr. Pivonka was able to share some time and insight into scoliosis with us, how to catch it early, what you should do right now if you or a loved one have it, and what to expect from treatment. All this and more packed into this episode. Let's jump right in. Welcome, Dr. Pivonka. Thanks for being here today. What exactly is scoliosis? I know it's a curvature of the spine, but what is it exactly and why does it happen?
So, basic definition for scoliosis, like I said, is a curvature of the spine. Technically, it's a sideways curvature with rotation of the vertebra. And the curvature has to measure over 10 degrees for it to be considered scoliosis. And they don't really know why it's caused. It's hence the term idiopathic.
Could it be that it happens during puberty, during fast growth rates or things like that? Is it typically happening in younger adults or young kids?
There's different varieties of scoliosis. There's some that happen as early as the infantile age, under the age of 2, juvenile types between the ages of 3 and 9. And then adolescence is the most prevalent, which happens between the ages of 10 to 15. And then a growing segment of the scoliosis population, unfortunately, is adults. Adults are the fastest growing segment for scoliosis at this point.
It's interesting that we're seeing more adults now coming up with scoliosis. Do you think this has to do with the way people are working or some factor in their life that's causing curvature of their spine? Or what, in your opinion, is the increase caused by?
I think the reality of it is that we just have a lot more people at this point that are in the baby boomer generation. We have a lot of people that are over the age of 65. And so that segment of the population has reached their point where they're getting to be older now, and the majority of them probably had some scoliosis as an adolescent that now worsens as an adult, or they've done types of jobs, or they've had jobs where they sit a bunch and they destabilize their spine, and then as they age, that turns into an adult onset scoliosis or de novo scoliosis. So it's just a lot of people over the age of 65 at this point. I think that's pushing that number up.
So you mentioned something there that their scoliosis could be getting worse over time, and my understanding is that this is a progressive sort of condition where if left to its own devices, it continues to progress to the point of potentially needing surgery.
Well, what the 50-year studies on scoliosis show is that, if your scoliosis stabilizes itself below 30 degrees, your chances for progression are probably not going to be that much. If it stabilizes above 30 degrees, then you're probably going to have 10 or 15 more degrees of movement through the course of your life. If it stabilizes above 50 degrees, you're going to move 1 or 2 degrees per year. But I think with the de novo type scoliosis or degenerative type scoliosis, I think you can have just a minor curvature of your spine, probably less than 20 degrees, that over the years just loses the ability, the spine loses the ability to support itself, and then the curve advances, and they typically advance pretty rapidly. So I don't think there's been any long-term studies on that, but I have a feeling that they'll be coming with the amount of people that are ending up with de novo type scoliosis at this point.
What is it you guys do in your office to treat scoliosis? Are you trying to reverse it or just sort of stop that progression?
Well, depending on what type of patient we're looking at. If we're dealing with a child, our goal is to see that child as soon as possible. Because the smaller the curve, the better the outcome. So a lot of orthopedists and MDs will be like, well, if it's under 20 degrees, we're not going to do anything about it. But in my philosophy of if it's under 20 degrees, that's probably a great time to get started, because we can probably affect that curve without having to do something more drastic like using a brace. We can probably use some good scoliosis-specific exercise protocols and some traction protocols and probably deal with that scoliosis. But once that curve gets above 25 degrees and the child still has growth left, then we're going to recommend bracing. And there's newer styles of brace on the market that are overcorrective type braces. And so, the goal of those braces is always, number one, to stabilize the curve. But in these newer braces, we can actually affect a certain amount of correction. So I have been able to take kids that have curves in the 20s and low 30s and reduce them down below 20 and maintain them in the 15 degree range. And so that's a newer thing. That's not been possible in the past, but the newer styles of braces, we can actually afford correction of the spine. In adults, it's just basically trying to prevent further progression of the scoliosis deformity and also help them deal with pain. And that is a hit and miss. I mean, some adults are pretty bad off when we see them, so there's only so much we can do for them. Some of them get pain relief. I would say probably 60-70% of the patients I see in the adult capacity will achieve pain relief, but then I've got that 30% that just don't seem to get any better. So, it just kind of depends upon the person in front of you at that time.
You brought up a good point, and perhaps it's a silly question, but what are the symptoms of scoliosis? I mean, I know the spine is curved, but does that translate then into pain or some sort of loss of function, numbness, or what are sort of the symptoms? How would someone know if they have scoliosis if they can't see that their back is curved?
Well, that's the hard part. For kids, they don't really display any symptoms other than postural changes, so they're not going to typically have pain with their scoliosis. So that's kind of the odd thing, is that the spine can be twisting and can have 50, 60 degree curves in it and have no pain whatsoever. But the way you want to detect scoliosis in a child is look for obvious outward signs. So if your child bends over in front of you and you see a noticeable hump on their back, then there's most likely going to be a curvature. If you notice that one shoulder suddenly gets higher than the other or starts to rotate forward, or get drastically high, that's a sign for scoliosis. If you notice a hump or a bump on their lower back down close to their hips, that's also a noticeable sign for scoliosis in an adult or an adolescent. In adults, you'll notice definite postural changes, forward listing of the posture. You're going to notice side shifts in the posture. Most of those adults do come to us with pain, so they're going to have pain associated with their scoliosis in the large majority of them. But I have seen some pretty bad scoliosis in adults where the patient has no pain. They're just coming because they notice that they're getting shorter, which is another sign for scoliosis in adults. So, but in kids, it's just basically you got to look for the outward signs. And so there are tests you can do at home to, check your child if you have a family history or if you just want to check the child, period, because they don't do these checks in schools that often anymore, where they used to do them routinely back in the 70s. But now they don't. So there are tests you can do at home.
So the symptoms are typically pain, and you've got lots of different treatment options: bracing, exercise, traction, for curves less than 25 degrees. For people that are in a lot of pain or have curves that are greater than 25 degrees that maybe are outside of what you might be able to do with bracing or exercise, do you have somewhere you can refer them to perhaps look at surgery, or what are some of the other options that might be outside of what you might be able to help with if too much time has gone by?
Yeah, so if we do have a patient that unfortunately reaches that level where surgery might be needed, there's definitely different types of surgical interventions you can undergo. I'm not a surgeon, so I can't really speak to them, but I do know the different varieties. There's the classic rod emplacement where you'll get two titanium rods up either side of the spine attached to the number of vertebrae that need to be corrected. There's also newer techniques, one being vertebral body tethering, which is kind of a newer procedure, but I've seen some pretty drastic results with a lot less recovery time and a lot less range of motion loss for the patient. So I have contacts here in Arizona for standard surgeries, and then for the newer surgery, the VBT, vertebral body tethering surgery, there's hospitals in the country that specialize in that I will give patients information to contact those hospitals. The one I typically send to is Shriners Hospital in Philadelphia.
For those patients that you can help, it sounds like early intervention is really the key. How long would it take for, say, a child that has a light scoliosis to sort of see results from your therapies, whether it's bracing, exercise, traction? Is it sort of a yearly type of treatment plan, or is it a few months? And how often do they need treatment to really see improvement?
That's a good question. So if we have a patient where the curvature is under 25 degrees, then we're typically going to recommend some in-office rehab and see if we can avoid bracing. And so we will do typically 2 to 3 months of therapy, and that therapy is going to be 3 days a week, and it's going to entail some very specific scoliosis exercises, also some traction protocols, and the exercises we use a variety called CAS, which stands for Scientific Exercise Approach to Scoliosis, which is developed in the iSequo Institute in Italy, and they're a very specific type of exercise protocol that helps the patient understand how to correct their own scoliosis and then do certain daily activities while in that correction position. And then we use a traction modality using an orthotic called the Scully roll. And the principle behind that is that in kids' bones, their bone is soft and pliable. And so we're able to, if we put maximum bending into these specific segments, then we can actually see that those segments will deform a little bit, not all the way back to perfect. But if we can get that bone to deform or stop deforming and stay where it's at, then that's a win. And so if we have curves below 25 degrees, then we can typically get a sizable improvement. Like we can get 10 degrees off those curves in a period of 2 to 3 months. And then beyond that, if we don't, then we know that's a curve that probably is going to require more aggressive therapy, maybe bracing, things like that.
All of the things you're talking about kind of lead me to believe that the wait-and-see approach to scoliosis treatment really is a bit outdated. Waiting and seeing amounts to waiting and seeing it get worse over time. Does scoliosis ever reverse itself?
There's in the infantile type of scoliosis, you will see a large majority spontaneously improve. I think the number on that is about 80%. But in the other forms of scoliosis, juvenile, adolescents, and adults, that scoliosis is never going to improve itself. The history of scoliosis is always progression. So in a juvenile case, the chances for surgery are quite a bit higher than an adolescent case because the spine has a lot longer to deform itself. So it's always early intervention. So, doing a scoliosis check on your child at home is a really good way to ensure that you find a scoliosis as soon as possible, because the sooner we find it, the sooner we treat it, the better the outcome. And so, doing a forward bending test at home with your child kind of bent over at the waist and just looking at the contour of their ribs, looking at the contour of their back, looking at their shoulder height is a really good way at home to find that scoliosis early before, I get the unfortunate case where they come in and say, well, we never saw this, and suddenly it's here, and the kid already has a 40-degree curve that's probably been there for a year and a half, just unrecognized. So it's always better to find it earlier than later.
For someone that has a concern that thinks maybe their child or maybe even themselves have scoliosis or a curvature that they want to have checked out, what would their next step be?
Well, if you found yourself having a scoliosis or your child having a scoliosis, then the first thing to do is always get a consultation. So in our office, we do offer a free consult. If you have x-rays, so if you've had x-rays taken at an imaging center or an orthopedist office, you can bring those x-rays in. I'll certainly sit down and go over any case with anybody for a few minutes at no charge. If we do see a patient where they don't have x-rays, then we do have an x-ray fee of $97 to perform those necessary exams to better diagnose the scoliosis. And because of June being Scoliosis Awareness Month, we are offering that for any patient that calls us looking for help from scoliosis. So the first thing is always, get a good consult. We'll sit down, look at it, see if we can do something for a patient. If not, then we refer them to the proper providers outside of our office. But if we can do something, then we'll definitely let people know what we can do.
Great. Dr. Pivonka, thank you for taking time out of your busy day today to talk with us, and I appreciate your time.
Thanks, Ken. I appreciate you having me.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.